Hello everyone. So once again, I'm here to present my fourth article under Module 4 Human Rights and Related Issues. So the title of the article that I'm going to present is COVID-19 and Domestic Violence, a Possible Public Health Crisis. This article was written by Anand Kumar of India, who was an associate professor at Xavier Institute of Social Service. The first part is the abstract. So the COVID-19 pandemic and subsequent lockdown to mitigate the spread of the pandemic has led to social isolation, reduced social support system, and increased cases of domestic violence against women. The United Nations and other international and national agencies speculate further increase in it and have suggested governments to take appropriate action to safeguard the health and human rights of women. Many governments have also taken steps and working towards it by starting helpline and counseling services. So this article reviews the concerns raised by these agencies, interventions introduced, and its future implications. It also argues that apart from reported cases of domestic violence and its negative consequences on individuals and families, it would also be interesting to study the positive impact of living together, as this pandemic is different from other emergencies. And lastly, this article also suggests the need for further research to understand the reason and dynamics of such violence, considering men and women both are engaged in such violence against each other and bear its consequences together. Now let's proceed with the introduction of this article. So in the past few months, there have been reports of increasing domestic violence in the print and electronic media, linking it up with the COVID-19 or SARS-CoV pandemic and subsequent lockdown in many countries. So apart from these cases reported in the media and to other agencies, so there were also increase in the domestic violence reported globally. So especially in the countries of China, United Kingdom, United States, Brazil, France, and Australia since the COVID-19 outbreak. And the alarming issue is that the number is likely to increase due to the COVID-19 pandemic as security, health, and money worries and strains are accentuated by cramped and confined living conditions. Emerging data show that since the outbreak of COVID-19, violence against women and girls, particularly domestic violence, has intensified. With more countries undergoing lockdown to reduce the spread of COVID-19, the danger of another public health crisis, domestic violence, is becoming apparent. So the countries are not just fighting against COVID-19, but also another public health crisis uh, was emerging in their countries, and that is domestic violence. So there was a positive impact of doing lockdown in their countries, and that is to mitigate the spread of COVID-19. But on the other side of the story, it also increases the cases of domestic violence due to this lockdown being imposed. As a result, the pandemic has created anxiety among people, leading to fear, financial concerns, insecurity, loss of job, which has its own behavioral and psychological manifestation and may lead to stress, altercations, fight, conflict, anger, and violence. Besides, the lockdown has increased the burden on women to cook, feed, and take care of household chores and family members who are at home. And the closure of schools has further exacerbated this burden and placed more stress on them. And women in abusive relationships may be more likely to be exposed to violence. So that's the introduction of this article. Now let's proceed to the methodology being used in this article. So as I have understand while reading this article, so the author Anna Kuman was doing review of other articles on the same interest or in this particular topic. So he gathered different data and information from other uh, research and published articles to come up with this article, which basically an article examining cases of domestic violence. Now let's proceed to the results and discussions on this article. So young women and girls are at higher risk of intimate partner violence and other forms of domestic violence during the pandemic, as reported by the United States. So women are closed behind the doors without much extended help from male members of the family due to strong gender norms and agency-like patriarchy. So basically, when we speak about domestic violence, the victims are most likely women and younger girls, because mostly they cannot actually defend themselves from these perpetrators. And the sad thing to note are that perpetrators uh, were relatives of these victims. Domestic violence affects both men and women, where both are equally violent. In such a scenario, the reported cases picture one side of the story, presenting women as weaker sex, vulnerable to domestic violence, where men are perpetrators and women are victims. So there was an argument that women were not just the victims of those domestic violence, but also men experience also domestic violence or abuse from uh, women. But in this particular article, it has been featured that most of the victims are women and younger girls. But we cannot deny the fact that there are some cases that men were also victims of domestic violence. There are studies that show that during the war, emergencies, and other similar situations, women are more vulnerable and become a victim of violence. But we need to understand that this pandemic is different from other emergencies in which everyone is equally vulnerable, irrespective of class, socioeconomic status, and gender. So we need to be cautious in equating and extrapolating this vision with other emergencies. So that's what I have mentioned, that women and younger girls were more vulnerable to in terms of domestic violence compared to men. But we need also to understand, as the author said, that everyone is vulnerable in this um, issue, the issue of domestic violence. So in conclusion, domestic violence is not new, pervasive globally, and it would be wrong to deny the chances of an increase in violence against women during the pandemic. The timely concern and speculations of a rise in domestic violence expressed by various agencies working on women and violence issues are good initiatives to alert the state and its agencies to take proactive action toward prevention to address this issue, creating more demand and greater need for services. So this article helps to alert those government and other agencies to take actions also to other side of emergency apart from COVID-19 pandemic, because there were alarming cases, increasing cases of domestic violence brought by the imposition of lockdowns. The government's response and initiatives to the concerns raised about the increasing domestic violence are appreciable amidst the pandemic. It is hoped that it will help to safeguard the health and human rights of women victims of violence and mitigate the negative impacts and consequences of the pandemic. Nevertheless, the response are limited and not adequate to cover every woman. So thankfully, there were some governments and there were some agencies and organizations who are proactively uh, very responsive towards resolving cases of domestic violence. But uh, sad to note that those responses are very limited to cover all the victims, especially women who are victims of domestic violence. So we need more governments, more organizations to take part in addressing this problem of domestic violence. And finally, the governments need to formally integrate domestic violence and mental health repercussions into the public health preparedness and emergency response plans against the pandemic COVID-19. So the author would like to suggest that apart from other health issues relating to COVID-19, they must include also cases of domestic violence that might somehow the result of the existing problem, which is the COVID-19. So that's all for this presentation of article. Once again, thank you so much. I'm Ricky C. Arot, a MAID students major in social science. Thank you.